Good morning, or good afternoon to some folks who might be joining us on the West Coast. Welcome to Reach Talk. I'm your host, Stan the Man Martin from Buffalo, New York. Looking forward to our conversation today. We have a very exciting show for you all. So, I'm very hyped, very amped, as you can tell. But before we get into our dialogue, I want to ask my colleagues and my esteemed friends, Ebony and Samantha, if they could introduce themselves. You want to say a few words, say hello to our folks who are joining us. Let's go ahead and start with Ebony, then we'll go to Samantha.
Hello, good evening, good morning, good afternoon, whenever you have the opportunity to listen to Reach Talk. As always, I'm glad to be with you. I'm Ebony White, the community outreach coordinator with Reach Initiative here, and also with the African American Health Equity Task Force. And I am so excited about today's show. So I have my pencil and my notebook because I'm ready to be informed. So, hi, Samantha. How are you?
I am doing really well. Thanks for that shout out, Ebony. Yeah, my name is Samantha Nephew. I am a healthcare advocate with the Healthcare Education Project, which is 1199 SEIU. I am really excited to be with everyone today and to talk a little bit about what we do as the tag team. So, Stan?
Yes. Thank you, Ebony, and thank you, Sam, as we call her affectionately, for joining us today. Just real quickly, for those who might not be as familiar about Reach Talk and what Reach is, we are, a how do I want to say this? We are a group of concerned citizens. Here in Buffalo, New York, where we address some of the toughest decisions. We have some of the realest conversations surrounding chronic disease prevention. Also, we talk about, how do we, collectively address the inequities, and when it comes to healthcare, when it comes to, social justice, and the things that really impact the community of color. So we're very excited, not just about our show on today, but the overall work that's happening here in Buffalo, New York, in our community. So that being said, just real quickly, Reach, we're focusing on increasing food and access to food and nutrition. We have some food deserts, as some people say, where people have difficulty accessing food and services. So we certainly looking to bridge the gap in that area. We want to improve relationships between healthcare providers. Improve community and clinical linkages. So that those individuals who when they're meeting with their doctor or they're meeting with their physician or healthcare provider, that they can have bi-directional conversations, that increases, their adherence to whether it's medication and also meeting them where they're at in terms of the services that he or she or they may need and when it comes to their healthcare. We also have a diabetes management program that Ebony is spearheading, in our community to address those gaps in those areas. So you'll hear more about that, in some of our future shows. And also, we do a lot of work surrounding breastfeeding as well. When you think about breastfeeding and in communities of color, this isn't something that oftentimes discussed or talked about. So, that is something that, we try to build more awareness and education surrounding. And last but not least, believe it or not, we talk a lot about, how do we prevent the initiation of tobacco use? How do we really help those who want to quit to quit? So that is the conversation that we're going to have today. We're going to roll up our sleeves, take a deep dive into that. So that being said, I'm going to turn it over to my good friend and colleague Samantha to take us away. Then I'm going to come back and join you all later on. All right. So Samantha, without further ado.
Thanks for that, Stan. That was a really great overview of what we do as Reach and all the work that we do. So I will actually get started. Today we're focusing a lot on the Reach Tag Team, which you mentioned was a lot about the smoking cessation programs that we have here, and the trouble that it causes in our communities, the health to our communities. It's not just yourself; it's the people around you. And I can't think of anybody who could speak to this any better than some of our guests on the show today. So I want to take a second to go ahead and start with Rashawn. Please go ahead and introduce yourself to our listeners.
Thank you, Samantha, Sam, Ebony. It's great to be here on this fabulous Friday. So excited about this conversation, getting into this with you. So I'm Rashawn Smalls. I'm a tag team member, in which I get a chance to talk about later. But I'm also an employee of CAI, and I work in a capacity of a program manager for advancing tobacco-free communities. And basically what this involves is working with the community, stakeholders, elected officials to sort of create an environment that is supportive of policies that make it easier for people to quit smoking if in fact they are smoking, and also to help prevent youth from ever even starting to smoke.
Thank you for that, Rashawn. And we hear your little one in the background.
Yes, I'm sorry about that.
No.
He's an animal.
Don't ever apologize. It's the new times. But with that said, I would like to turn it over to Ms. Beverly. If you would like to go ahead and introduce yourself to us for a little bit.
Hello, my name is Beverly Johnson. I'm a member of the Reach Tag Team, and I just like thanking everybody for allowing me to be part of it.
Sounds good. And then Miss Annette, if you could go ahead and introduce yourself to our listeners. Oh, she looks frozen.
Yeah, it appears she is.
Oh, we might be having some connection issues with Miss Annette on today's show. So we'll come back if that resolves itself with her technology.
It wasn't allowing me to mic. Hello?
Are you good now?
My name is Annette Golden, and I'm a co-lead with Stan the Man.
Yes, she is my co-lead.
Stan, do you want to go ahead and introduce Miss Annette? Unfortunately, I think we're having some tech issues.
Right. Yes. Annette definitely is a champion in our community. She's done a lot of work along with Beverly, which we're going to talk about in a little while, in terms of just raising awareness about tobacco, helping those who want to quit, as I mentioned earlier, to quit, and the work that they've done. The tag team, the Reach Tag Team, we couldn't have done it without them, and of course with the support of Rashawn. So I think that being said, I'm gonna turn it back over to you, Sam.
Yeah, absolutely. Thank you for pitching in there. We appreciate it. So with that, I'm actually going to just start with Rashawn. If you can tell us a little bit about the Reach Tag Team. What do you do? What's the mission?
Yeah, so I mean, obviously everyone on this show knows what REACH is an acronym for Racial and Ethnic Approaches to Community Health. So part of my role within REACH is I'm simply a member, and REACH as a project of CAI. I have I work within the capacity of well, let me start with this. Because REACH has an emphasis on tobacco with the Tobacco Action Group members, we focus on addressing health disparities with respects to tobacco along the Ferry Corridor. And it's really a perfect fit when you think about it. It's an opportunity for me to partner with REACH Tag Team members to join and create what, pretty much public health equity. So the emphasis or the crux of my work with REACH is to promote public health equity. And so within that capacity, we also have a number of initiatives. One of those initiatives is multi-unit housing. So we believe that affordable and safe housing also should be smoke-free, where people live. Others should not be exposed to first, second, or third-hand smoke. Therefore, we work to encourage multi-housing units to adopt smoke-free policies. Another such initiative that we focus on is worksite policies. We believe that where you work at should not be a death sentence for you as well. We talk about encouraging work sites or work employers to adopt smoke-free policies. And another initiative is tobacco-free outdoors. So where children play at, our beaches, our park, our recreational spaces, we want to also protect those spaces and have those spaces as sacred and free of secondhand smoke. And I would say another initiative as a part of the REACH team and ATFC work is the retail. So part of that work involves with countering the tobacco industry's aggressive and manipulative marketing tactics, which has in fact led to addiction among particularly Blacks and brown people throughout the city of Buffalo, and I would say throughout Western New York.
Thank you so much for that, Rashawn. I would love to turn it over to Ms. Beverly, if you want to tell us a little bit about your involvement with REACH and what do you do with the group?
Well, I'm going to tag members that go out and talk to different people and educate them about the different smoking aids and let them know about the advertisement that the tobacco industry go do with our community, and to show people, give them some help learn history about tobacco and try to help them stop smoking and encourage them, because we know not against people that smoke, but we just try to encourage people to stop smoking because of the health problems that it causes, but overall on their health.
And that's actually a great segue, Ms. Beverly, if you want to tell us a little bit about what impact has the tobacco industry had in our communities?
And well, the impact they have, I see basically for our Black and brown community, is that advertisement is faced to them, and the menthol cigarettes is geared to them and to our youth. If you look at some of the stores, you see some of the advertisement is lower, so for kids' eyesight, that they see different things, and it's geared to our youth as well as our people.
That's great, thank you. And what kind of reactions do you get when you're out there talking to people on the streets about, you know, tobacco and what it means to our communities and our health?
A lot of people know that smoking do cause a lot of health issues, but they don't understand how they got started, the history of tobacco. And during the cafes, we learned a lot about the different histories of how the tobacco industry used it to advertise for our community.
That's great. Thank you, Ms. Beverly. Rashawn, can you tell us a little bit more about specifically menthol tobacco and its impact on Black Buffalo?
Yes, that's a great question. So if you recall, back in 2009, the FDA, Food and Drug Administration, removed flavored cigarettes from the shelves in an effort to protect public health. Interestingly, that protection left a loophole for the flavored tobacco product, which causes the most harm in Black and brown communities, that is menthol. And so we talk about menthol. Menthol is that flavored product, that added to cigarettes, which allows for one to inhale cigarettes more deeply, leading to greater doses of nicotine and stronger addiction. And this coincides actually with a local data collection survey we did here in Buffalo with 400 city residents. 45% of respondents agree that menthol smokers find it harder to quit. And also you think about 49% agree also that menthol, or youth who smoke menthol, menthol makes it easier for youth to start smoking. So this is consistent not only with the evidence, the scientific evidence, but the research that's taking place across the country when it comes to menthol, that menthol is a problem. It drives addiction. And as already Beverly had mentioned, the tobacco industry knows this very well. They have a long documented history of targeting African-American communities for mentholated tobacco products, which there's no coincidence that 85% of Black smokers in this country who smoke mentholated tobacco products.
Yeah, thank you so much for that. I mean, I would just say from my own experience, that's how I started. I think I took my first drag of a cigarette when I was 16, 17 years old, and it's a lot easier to, you know, inhale. It's not as rough as the usual stuff, so it's definitely a lot easier for younger people to do that, and it you know, it feels like how it's romanticized or whatever in the media and whatnot. So definitely, menthol cigarettes is a good way to start working on this initiative. So with that said, we were supposed to have Councilman Wingo with us today. Unfortunately, he's unable to join us for our conversation. But I don't know if, at this point if it's Stan, if it's Rashawn, maybe Miss Beverly. What is the kind of thing we're trying to work with our local legislators around tobacco?
Yeah. Thank you, Samantha. Rashawn, I was certainly I wanted to ask you that question. You know, and Beverly, I also want to come back to you as well. Like, how are you working with, you know, elected officials? You know, how are you working with the faith community? If you could talk a little bit about that, you know, that would be great. Some key partners to make this happen.
No, so that's great. So we talk about moving menthol or mentholated tobacco products from the shelf, right? Restricting the sale simply because it drives the health inequities that you see among Black people in this country. 45,000 Black people die a year from tobacco-related illnesses. This is a point of emphasis for us when we work with the community, when we work with elected officials. So part of our role in that respect is to engage elected officials, to educate them, to help them see how mentholated tobacco products, how the tobacco industry is advertising in our community to target, attract, and addict inner city Buffalo residents. So we want them to be aware of this. We want the community to be aware of this. We want the community's voice to have a role in saying this has to stop. So we also believe that it's extremely important for the faith community to be a part of it. The faith community has long been, you know, part of the vanguard, the leaders in our community. They set the tone for issues that matter most to us. So we need the faith leaders to be involved with this, because smoking is just not outside of the church. People who are in the church smoke. So they also need to be educated. So it's important to bring awareness to that. And part of that initiative, we worked with the Center for Black Health Equity, which is a national organization, which started the No Menthol Sunday campaign, which has been around for about 7 years. It is about engaging those faith-based leaders to be part of this larger conversation. And so we want every part of our community to be a part of raising awareness about, you know, this disparity when it comes to tobacco-related illnesses, but specifically menthol.
Okay. And Ms. Beverly, you know, I know you mentioned you do a lot of community outreach. You're a champion in this community, well respected and trusted. So when you're, you know, what's been your experience? Like when you talk to people about the menthol tobacco, when you talk to them about how they're being targeted, are they receptive? Are they resistant? You know, can you speak to that?
Yeah, most of the people are surprised. They didn't really realize that they knew that they smoked menthol, but they were surprised to know the history behind the menthol. And it was like a lesson that they learned, and they like, oh. And a lot of people wants to quit, and they starting to quit. And like Rashawn said, working with the faith-based community, they listen to their pastor, they listen to their first ladies, and that's a good thing that they come out and talk. And then talking to people that live in the house, and like when we went out and what's the name, East Ferry Grider Apartments, we was over there, and we talked to a lot of people who don't like people smoking, but they scared to deal with other people because they do smoke. And you got people half and half that wants to quit smoking and then don't want smoking in their apartments, but you got people that still want to smoke. But they do agree with the policy as far as the non-smoking area because of the kids. They will agree with that. So they figure they smoking outside that it don't bother them, but the smoke go everywhere. So you got to keep educating and keep talking to the people and let them know that they are being targeted, and they kind of get a little pissed behind it.
Okay. Wow, that's interesting. So just quick check-in. So it sounds like you all are doing a lot of work surrounding building awareness. You know how tobacco industry targets mark their deadly product when used as intended. Will kill you.
Mhm,
Then you also provide some education, some information
mhm.
in regards to the not just the impact on themselves, but also on other people being exposed to secondhand smoke. And you're mobilizing, you're building awareness and education, and you're mobilizing the community around this issue. So we said we were talking about tobacco, but do they get confused, or do they ask you about marijuana use? Like when they throw that in there, does that topic come up?
And that topic comes up a lot, and with a
And
lot of people to compare it to with the marijuana, but we let them know that it's a difference, and that our focus is basically we come back to we talking about the tobacco. We're not trying to eliminate you from smoking, period, but we just our gear is to try to let you know about what's going on in our community about the tobacco and the being target from the tobacco industry.
But Sean, looked like you were leaning in. You were going to say, were you going to add?
Yeah, thank you for that question right there. I think the most important thing to keep in mind is that we do know that smoking tobacco kills you, right? And I've already mentioned that 45,000 Black people a year die from tobacco-related diseases and illness, right? This is the leading cause of death, preventable death for Black people in this country. It is, in fact, the leading cause of death for Americans, preventable deaths in Americans, right? So our focus, again, is on tobacco, we want to make sure that we are helping people to understand this right here, because there's not enough being talked about, and we don't want to confuse it with other issues. The issue is that we need to talk about how tobacco is killing our community and how we can confront and counter, how the tobacco industry is marketing to us for this deadly product.
Right. No, I appreciate. Thank you both, for sharing that. I hear that a lot, myself, and I want to kind of like bring Ebony into the conversation, because oftentimes when we think about tobacco use, we're thinking about, we only think about the immediate effect onto us, and we don't oftentimes have conversations about how tobacco use can exacerbate other health conditions, diabetes, for example, in terms of circulation, or even COVID. I just want to see if Ebony, if you had any thoughts or comments, if you in your diabetes management program and conversations, do you talk about tobacco? Do you talk about substance use, things of that nature? Just wanted to see if you had some thoughts and comments about that.
So in diabetes courses, we discuss the impact that smoking has and how it just exacerbates, as already was shared, on your cardiovascular health, your circulation. So, and it becomes so people that have diabetes, they already are battling and trying to maintain that and the impact that the diabetes is having on their body. It does not go away. It is something that must be managed. But when you add to it smoking, poor nutrition, it just takes it to a whole nother level. But while we were talking and Sam shared, cigarettes were romanced. My mother is one of 15 children. I remember for Christmas, my grandfather was an avid smoker, Winston Light 100s. That was the thing, right? In Salem's, and he would wrap cigarettes as gifts because everyone smoked, right? But when you talked about really what it was, that's how they cope with stress. My grandfather was born in 1913. So when you go to the behavior, which is the smoking, it was their counteract to stress. So they would take that, and it was addictive, and they didn't view it as addictive until at one point my grandfather became very ill, and that's when he ceased to give out cigarettes as a gift to others. He said, I didn't realize what it was doing to me, and that was many years ago. So it was romance. It was in the movies. Everyone smoked. They had a glass of cognac, and it was just about creating a theme, if you will. And how all of those things, when you know more, you can do something about it. We are literally going back, and the fact that you're out, and I applaud everyone that goes out and gives that education to our community at large, to just share with them like the impact of something. I know it was something that was taught and people were agreeable to, but this is what it's doing. 45,000 people dying through cancer and CHF and COPD and respiratory issues, and they're getting younger. You know, some of these diseases people were not being developed until they're in their 60s. They're developed now in their 30s. And it's part of the behavior and how we address stress and how we grow comfortable. So making people a little uncomfortable with, you can't smoke in this building, you can't smoke at this job. I remember working in a factory and it was so smoky, I thought it was on fire because everybody smoked. It was thick. But I didn't know that I had the right to say, this is the break room and I don't have to be in this smoke-filled room. But making people a little uncomfortable for the benefit of the public is important. So, yeah, I'm with it. I love it. I love the time that we're taking and having those one-on-one conversations, table and events, church, corner stores, just being everywhere and just letting folks know and working on legislation around what is okay and how it impacts us all, because it's in the air. Smoke is in the air. It's not in an isolated place, and how it impacts us all. So great work, tag team.
Yeah.
I was going to sing the song in my head, but I'm going to leave you alone because that's all I hear.
Right. So it sounds like you all are denormalizing, you know, tobacco use. And, you know, just looking at some of the research, you know, or some of the data, you know, rates are down, but there's still a lot of work to be done, especially in Black and brown communities, in reaching, y'all caught that, right? In reaching Black and brown communities as we, you know, move forward. So quickly, we'll have just a few minutes remaining. I just want to make sure that for those who want to quit, do you all have any information that can help those who want to quit to quit? And any closing last thoughts and comments? Let's start with let's go Beverly first, then we'll come to you, Rashawn.
Yeah, Reach, we go out with us, the tag team. We do have aids that we can help them get gum and patches. We have like tobacco specialists, and we work very closely to the Quick Line. And as we out, we study educating, like you were saying, Ebony, about the education, about letting people know that smoking is the number one cause of majority of all our health issues that we have in our community. And that, like you said, like cancer, diabetes, COPD, breathing. People don't understand that. They don't realize how bad until you talk about it. And a lot of people don't smoke, and they're affected by the secondhand smoke. And that's encouraging them about that stuff too. And they need to know, because people figure I don't smoke, so it don't bother. But you smoking around a person, living around somebody that smoke, that they sick, making you sick.
Right.
So
thank you, Beverly. Rashawn, last thoughts, words, comments?
Yeah, so, I mean, Beverly spoke about the Quick Line. You can go to www.newyorksmokefree.com, www.newyorksmokefree.com. You could also call the Smokers Quit Line, 1-866-New-York-QUITS, or you can dial 1-866-697-8487 to receive the sort of support from nicotine replacement therapy to professional coaching and just support for people who are desirous to quit. And I would also add that if you are living in a multi-unit housing complex and you are looking to have this discussion about how do we convert to a smoke-free house, you can contact me at rsmalls@caiglobal.org, rsmalls@caiglobal.org, or you can call me at 716-246-3006 at extension 704. So yeah, let's start this movement, join the movement to remove menthol and flavored cigarette products off the shelf.
All right. Well,
Thank you.
Thank you, Rashawn. Thank you, Ms. Beverly. You know, thank my esteemed colleagues, Ebony and Sam, you know, for being a part of our show today. Thank you all for listening and for joining the conversation. And if you want to find out more information about how you can join the movement, as Rashawn mentioned earlier, please visit us on Facebook at Reach Buffalo. You know, there's a lot of information about the work that we're doing, and please, reach out to each one, teach one. you know, as we say sometimes, and share this information and dialogue, and let's continue the conversation. On behalf of the Reach Talk team, I'm Stan the Man Martin. We'll see you on the other side. Enjoy the rest of your day. Stay safe. Thank you, everyone. Take care.
Reach Buffalo, promoting a healthy community. Reach, racial and ethnic approaches to community health locally in Buffalo to reduce racial and ethnic health disparities and rates of chronic disease. We want to make a change by reducing exposure to tobacco in housing and work areas, by increasing access to nutritious foods, by creating a breastfeeding community, by increasing referrals to primary care and community health providers, and by implementing community work groups. Reach Buffalo will concentrate on Ferry Street itself, as well as a community that resides within 4 blocks to the north and south of the corridor in 5 zip code areas: 14208, 14209, 14211, 14213, and 14215 in Buffalo, New York, with disparities in rates of chronic disease. Get involved. Ferry area residents will have an opportunity to have a platform to voice their opinions, organize, and make decisions in these efforts. For more information, you can contact Ebony White, Community Outreach Coordinator, at 716-268-2954.